again, thank you everybody so much for taking time out of your day to join us for today's NeedyMed special topic webinar, Saving Lives Through Early Detection. This is a lung cancer screening webinar presented by our partner, the American Lung Cancer Screening Initiative. Before we get started, I'm going to offer a few tips so everybody can make the most of the presentation. First of all, if you do have questions, you can go ahead and submit them at any time by typing them into the questions section. For some of you, it may actually be the chat section of your GoToWebinar control panel. Just know that we do reserve answering questions until the end of the presentation. We do keep the question segment brief. So if we don't get to the chance to answer your specific question, we will follow up with you by email. But of course, we will also provide the contact information for NeedyMeds and the American Lung Cancer Screening Initiative. Also, the heads up that today's webinar, like all of our presentations, is being recorded and it will be uploaded to the NeedyMeds YouTube channel. So we hope you subscribe to that. And go ahead and check out that handout section of your GoToWebinar control panel. That's where we uploaded some documents we thought you'd be interested in. Also, if that GoToWebinar control panel is smack dab in the middle of your screen and it's obstructing your view of our PowerPoint presentations, don't forget you can simply drag it to the corner of your screen, but be sure not to X out of it, otherwise you'll log yourself out of today's presentation. So let's get started, and I always like to start these presentations or webinars reminding everybody what NeedyMeds is and how we can help you, your loved ones, your patients, or your clients. We're a national nonprofit, and we are, as you will see, dedicated to the mission of educating and empowering those seeking affordable health care. Now, that's our fancy wording for our mission statement. But simply put, we connect people to healthcare savings and educational programs. And we do that completely free and completely anonymously through our website, needymeds.org, and our toll-free helpline, which is 1-800-503-6897. And the heads up, we are available Mondays through Fridays, 9 a.m. to 5 p.m. That is Eastern time because we are located in Massachusetts, and I'm happy to share that we also have Spanish-speaking counselors. Now, as you saw a little bit ago, part of our mission is educating people. And of course, we define that by educating people and our users about NeedyMeds and the resources we have, but we also define and fulfill that part of our mission by educating our users about important healthcare topics so they can remain healthy and share resources that will help their loved ones, their clients, or their patients stay healthy as well, which is why we are so honored to have our partnership with the American Lung Cancer Screening Initiative. Now, if you haven't heard of them, they're a nationwide nonprofit dedicated to raising awareness for early detection of lung cancers through screening. They are currently, as always, busy working with representatives across the country to make access to screening a reality for all. This is super important. And today, we have my friend and colleague, Raya Suleiman, who is a team member at the American Lung Cancer Screening Initiative, to walk us through everything that they do and how it can affect you. Raya she advocates for early detection through screening as her role at the American Lung Cancer Screening Initiative. And today, as I said, she's going to discuss what that's all about, including the benefits of screening, and she's also going to offer tips on how we can all prevent lung cancer. So without further ado, I'm going to go ahead and pass the mic and the screen to Raya. Now, as she's doing that, which she did super quickly, I'll remind everybody that if you do have questions, you can go ahead and submit them by typing them into the question section or the chat section of your GoToWebinar control panel. With that, I'll go ahead and pass the mic to Raya. Thanks for being here, everyone, and enjoy the presentation.
Thank you so much, Carla, and thank you to NeedyMeds for facilitating this wonderful collaboration. I'm so excited to share more about the American Lung Cancer Screening Initiative and what we do. My name, again, is Raya Suleiman, and I'm a member of the American Lung Cancer Screening Initiative, or ALSI for short. And today I'll be giving a presentation on lung cancer and lung cancer screening. Again, we're so grateful for the opportunity to present to you all today. Before we get started, I'd just like to request that everyone remain muted during the presentation. As Carla mentioned, we will answer questions after the slides have been presented. But we would love to take any questions at the end of the presentation, so feel free to put your questions in the chat box for us to address. And if you're interested in learning more about ALSI at any time, we invite you to visit our website at www.alcsi.org, or you could just email us with any questions at any time. Before I get into the content of the presentation, I'll share a little bit about what the American Lung Cancer Screening Initiative does. And we're just a 501c3 nonprofit that works to raise awareness for lung cancer and lung cancer screening. We have a team of over 70 passionate students and doctors across the US, and we've worked with community organizations like the South Asian Network and American Indian Cancer Foundation, as well as city and state health departments, including the NYC and Connecticut health departments. We hope that in educating communities about lung cancer and screening, that high-risk community members will be encouraged to seek lung cancer screening. Today, I'll discuss both lung cancer and screening, addressing questions such as how common lung cancer is, what lung cancer screening is, and how you can get screened. To start things off, lung cancer is unfortunately very, very common. It's the second most common cancer in the US, excluding skin cancer. And this graph shows the American Cancer Society's estimates for the number of new cancer cases in the US. This graph estimates that new cancer cases in 2022 for the four most common cancers. And as you can see, it's estimated that approximately 236,740 people were diagnosed with lung cancer in 2022 in the US. And to put this number into perspective, it's estimated that about 6% of people will develop lung cancer during their lifetime in the US. And this means about 1 in every 15 men and 1 in every 17 women will be diagnosed with lung cancer. Moreover, not only is lung cancer very common, but it's also very fatal. And unfortunately, lung cancer is the leading cause of cancer-related death in the US and worldwide. In 2022, it was estimated that lung cancer claimed the lives of 130,180 people. And this graph shows the American Cancer Society's estimates for the number of cancer-related deaths in the US. And as you can see, lung cancer is far more fatal than breast, prostate, and colon cancers, causing more deaths than all of those three combined. Lung cancer makes up almost 25% of all cancer deaths, resulting in about 350 deaths each day. And every year, there are about 50,000 more new cases of breast cancer, but lung cancer causes over 90,000 more deaths. If we look at lung cancer incidence and mortality by sex and race, you can see that among males, lung cancer incidence is highest in Black males at an incidence rate of 71.7 per 100,000 people. Among females, lung cancer incidence is highest in white females at an incidence rate of 51.1. Mortality rates mirror incidence rates. So Black males have the highest mortality rates among males, while white females have the highest mortality rate amongst females. And from this data, the question that arises is, why is lung cancer mortality so high? Well, lung cancer mortality is so high because patients are typically diagnosed at later stages. This is a graph looking at the proportion of patients with lung cancer by stage, and stage is just a way for a doctor to classify a cancerous tumor based on tumor size. So if the cancer has spread to lymph nodes, if the cancer has spread to other locations in the patient's body, stage is a way to classify that. Currently, most lung cancers are diagnosed at a distant stage or later stage, when the cancer has spread beyond the site in the lung where it originated. And this graph is based off of data from 2008 to 2017, published by the National Cancer Institute. And as you can see, about 21% of patients are diagnosed at a localized or earlier stage, while about 51% of lung cancers are diagnosed at a later stage when the cancer has spread to other locations in the body. So why is this important? It's really important because the stage that lung cancer is diagnosed at correlates directly with survival. And we'll see this in the next slide. As I said, one way that doctors track the survival of patients is by looking at 5-year survival. And as you can see here, the 5-year survival for lung cancer at the early stages is high, but the 5-year survival significantly drops as the disease progresses and the stage becomes more distant. And then this graph is another way to understand the relationship between the stage at diagnosis and 5-year survival. So the 5-year survival for patients with localized lung cancer is 59%, but only 23% of lung cancers are diagnosed at that stage. In comparison, nearly half of all lung cancers are diagnosed at a later stage. And this is why early detection of lung cancer is so important. If we can detect lung cancer at an earlier stage, then the treatment options are much better and the prognosis is better. So with lung cancer being such a morbid disease, some of you might be wondering why the majority of lung cancers are diagnosed at such a late stage. And this is because the majority of patients don't start feeling any symptoms of lung cancer until the lung cancer has grown and spread to a more distant stage. And the most common symptoms of lung cancer are chronic cough, coughing up blood, chest pain, and shortness of breath. Additional symptoms may include hoarseness, loss of appetite, fatigue, persistent lower respiratory infections, and a new onset of wheezing. However, when people become symptomatic, the cancer has often grown and spread to a point where it's more difficult to treat and the outcome is poor. So if the diagnosis of lung cancer has to wait until the patient has symptoms, it's often difficult to catch the lung cancer early. So the next question we want to ask is, how do we catch lung cancer if patients are asymptomatic at an early stage? And lung cancer screening is done using something called the low-dose CT scan, and this is how we catch those lung cancers early. So if you're eligible for lung cancer screening, it's recommended that you get an annual lung cancer screening. And in the coming slides, we'll discuss what lung cancer screening is, who should get screened, and how to get screened. A really important distinction we want to make is that lung cancer screening is done using the low-dose computed tomography, also known as the low-dose CT, and not the chest X-ray. We use low-dose CT scan because it provides a more detailed picture than the chest X-ray, and it's far better at finding small abnormal areas in the lung. And the picture on the left is the picture of a chest X-ray, and the yellow arrows point to the abnormal area in the lungs, but it's pretty unclear. On the other hand, the image on the right is a picture of a low-dose CT scan of the chest, and you can see the abnormal areas much more clearly, and it's much more detailed than the chest X-ray. So it allows you to see the abnormal areas in the lung with greater detail, as shown by the red arrow. And the question that researchers wanted to answer is, how effective is the low-dose CT scan at detecting lung cancers at an early stage? And an important lung cancer screening trial called the National Lung Screening Trial, or NLST for short, tried to answer this question. So the NLST was a large national study with over 50,000 patients. And the goal of the study was to determine the effectiveness of using a low-dose CT scan to detect lung cancer in patients considered high risk for lung cancer. The study included two groups, a group of patients who received an annual low-dose CT scan and a group of patients who received an annual chest X-ray. By comparing the stages at which cancers were caught between the two groups, the study wanted to determine if the low-dose CT was better at catching more lung cancers at an earlier stage. As you can see, of everyone diagnosed with lung cancer, the low-dose CT scan caught the most lung cancers at an earlier stage, while the X-ray diagnosed more patients at stage 4, which is a late stage. And this has really important implications for survival. Because the low-dose CT scan caught more lung cancers at an early stage, these cancers were more likely to be treatable, and the prognosis was much better. This translates to a 20% reduction in mortality for those who underwent lung cancer screening using the low-dose CT compared to the X-ray. And so a concern with any screening test is accuracy. Essentially, how good is the low-dose CT scan at catching lung cancer? And for every 100 individuals undergoing CT lung screening, 75 will be negative. Of those 75 that are negative, 97.7 to 100% truly do not have lung cancer. This means that the test is very good at identifying people who do not have lung cancer. That is, if you do have lung cancer, the test will most likely come back positive and the test will not miss your cancer. If we move our attention to the 25 individuals that are positive, 23 turn out to be negative for cancer, primarily with follow-up imaging alone. This means that even if your test result is a false positive, it's really easy to rule out cancer using further non-invasive imaging. And then the 2 individuals that have a positive test result and truly do have lung cancer are more likely to be diagnosed at an early stage than if they were not to undergo lung cancer screening at all. This means that their treatment options and outcomes are much better. The results of this study were published in 2011, 10 years ago, and several studies have been published since then, further confirming the life-saving benefit of lung cancer screening in high-risk populations. One of the most important is the Nelson trial. In February of 2020, the results of the trial were published, and like the NLST, the Nelson trial had 2 groups. However, unlike the NLST, the Nelson had a group that received low-dose CT scans and a group that received no screening of any kind. A total of 13,195 men and 2,594 women between the ages of 50 and 74 were randomly assigned to undergo CT screening at baseline, year 1, year 3, and year 5.5, or no screening at all. And the results confirmed the life-saving benefit of lung cancer screening by low-dose CT. In the screening group, 58% of lung cancers were diagnosed at stage 1, and in the non-screening group, only 13.5% of lung cancers were diagnosed at stage 1. So we see here that early detection translates into a reduction in mortality, and in the low-dose CT group, there was a 24% reduction in lung cancer mortality in men and a 33% reduction in lung cancer mortality in women when compared to no screening. The Nelson trial also showed that with improvements in low-dose CT technology, the false positive rate was reduced significantly. So we've shown that lung cancer screening significantly reduces lung cancer mortality, but who exactly should be getting screened for lung cancer? The U.S. Preventative Services Task Force, also known as the USPSTF, sets guidelines for who should be screened for lung cancer. Right now, they recommend that people between the ages of 50 and 80 who have a 20-pack-year smoking history or greater and who are current or former smokers who quit within the past 15 years get an annual low-dose CT scan. And as you can see, the current screening guidelines require you to have a 20-pack-year smoking history. Now, pack year is probably a term that most of you have not heard of before, but it's just a way for doctors to track your smoking history over a period of time. A pack year is defined as smoking a pack of cigarettes for a year. So, for example, if you were to smoke 1 pack a day for 20 years, that would equate to a 20-pack year smoking history. Alternatively, if you were to smoke 2 packs a day for 10 years, that would also equate to a 20-pack year smoking history. And the important takeaway here is that there are many different ways to reach the same pack year history, and a pack year is just a way to help your doctors track your smoking history. I'd also like to point out that the USPSTF guidelines were recently updated. They had slightly different guidelines a little over a year ago and updated their screening guidelines on March 9th of 2021. The previous screening guidelines only recommended that individuals between the age of 55 and 80 with a 30-pack year smoking history or more get screened. Under the new guidelines, the lower age bound is lowered from 55 to 50, and the pack year smoking history is lowered from 30 to 20. These new guidelines will nearly double the number of eligible individuals for lung cancer screening in the US, and notably the most impaired increases in eligibility will occur among women and minorities. However, while these new guidelines will include more high-risk individuals, they only include individuals with heavy smoking history. There are other risk factors for lung cancer that are not accounted for in the current screening guidelines. And here, smoking is the primary risk factor for lung cancer. When compared to people who have never smoked cigarettes, a current smoker has 25 times greater risk of lung cancer. About 81% of deaths from lung cancer in 2022 were expected to be caused from smoking cigarettes. After smoking, the next leading cause of lung cancer is exposure to radon gas, which is released from soil and can build up indoors. Moreover, secondhand smoke causes almost 3% of new diagnoses of lung cancer and is expected to cause about 3% of deaths. Additional risk factors include exposure to asbestos, family history of lung cancer, COPD, and previous radiation therapy to the lungs. It's important that we recognize these additional factors because although lung cancer has a strong association with smoking, there are a large number of people in the US who have never smoked that still get lung cancer. Never smokers are defined as individuals who have smoked less than 100 cigarettes in their life. Because lung cancer has a strong association with smoking, people are often surprised to learn that lung cancer in never smokers accounts for about 10 to 20% of lung cancer diagnoses and is the 8th leading cause of cancer-related deaths in the US and worldwide. More never smokers die from lung cancer each year than people die from ovarian cancer. And then the graph shows the proportion of lung cancer cases that occur in people who have smoked in their life and people who have never smoked. It is then further broken down by whether they are current, former, or never smoker. And as you can see, 80 to 90% of lung cancers occur in people who have smoked during their lifetime, and about 10 to 20 occur in never smokers. Interestingly, women are more likely to be never smokers when diagnosed with lung cancer. In fact, in the US, 60 to 70% of never smokers diagnosed with lung cancer are women. So to summarize the last few slides, lung cancer is unfortunately the leading cause of cancer-related death in the US. It's so deadly because most lung cancers are diagnosed at a later stage when they have spread to other locations in the body. But early detection through lung cancer screening by the use of the low-dose CT can significantly reduce lung cancer mortality by up to 33%. Currently, only 5.7% of high-risk individuals are getting screened for lung cancer. And to highlight how low this number really is, we compare the lung cancer screening rate to the screening rates for breast, cervical, and colon cancers. All 4 of these cancers have screening tests that are recommended by the USPSTF, but right now only 5.7% of high-risk individuals are getting screened for lung cancer. This rate is extremely low in comparison to the screening rates for breast, cervical, and colon cancers. And the American Lung Cancer Association estimates that if we were to screen every high-risk individual recommended by the USPSTF in the US, we would save approximately 48,000 lives. However, we're only screening at a rate of 5.7%, which means that a lot of lives that could be saved are not being saved. And why is that? The lung cancer screening rate is low for a number of reasons, including limited awareness and concerns about access to screening, the cost of screening, and the safety of screening. In the next few slides, we'll discuss each of these topics, but the important takeaway is that lung cancer screening can help reduce an individual's risk of dying from lung cancer. The first potential concern we'll address is the cost. The average low-dose CT scan costs anywhere from $300 to $400, but most insurance companies, including Medicare and Medicaid, will cover the cost for eligible patients. There are a few exceptions. Medicare will only cover lung cancer screening until the age of 77. Not all state Medicaid plans cover lung cancer screening, and patients will still pay the usual fees for provider appointments before or after the scan. As I just mentioned, unfortunately, not all state Medicaid plans cover lung cancer screening. Here's a map showing which state Medicaid plans do and do not cover screening. Blue states have state Medicaid plans that cover lung cancer screening, and Massachusetts is one of them. Purple states don't have Medicaid plans that cover lung cancer screening, and in pink states, this information is not readily available. The first step to getting a patient screened for lung cancer is having them talk to their primary care provider, or PCP. And there are certain questions a PCP has to ask and topics that have to be discussed. One of these is the patient's past year smoking history, which we saw how to calculate in earlier slides. Once you talk to your PCP and you figure out you need to get screened, you need to find an accredited lung cancer screening center, and you can do this by going to the American College of Radiology's website. You can type in your location and you can find a map of accredited lung cancer screening facilities. This is a map of Massachusetts, so there are a lot available. As far as how the experience goes of getting a low-dose CT scan, it will require you to lay on your back for about 5 minutes. You'll be doing something very similar to the patient in the photo. And one thing to note is that this process will not hurt at all because this is a low-dose CT scan and you do not need contrast. All that means is that there will be no needles or injections involved. The low-dose CT scan is non-invasive, fast, and completely pain-free. The amount of radiation exposure is also very low. And a way for doctors to measure the amount of radiation a patient may receive through a unit is called the millisievert unit. And it's just a way to measure radiation and compare the levels of radiation received during different activities over time. For a low-dose CT, you'll be expected to be exposed to 1.5 to 2.0 millisieverts of radiation, and this is a lot lower than a full chest CT scan, which requires a radiation dose of 8.0 millisieverts. And to put that into perspective, you're exposed to 3.11 millisieverts of radiation a year just from breathing, cosmic radiation, eating, and the radiation from Earth. So a low-dose CT scan does not expose you to too much radiation, and it's less radiation than you are exposed to from just existing on Earth. So once you've talked to your primary care provider and they've referred you to a screening center, what's next? The doctor will receive the results of the patient's screening test and will follow up with the patient to go over results. There are 3 most likely outcomes. The first is that the scans are normal. If that's the case, then your patient will look to get repeat scans in a year. If they're abnormal but benign, the patient should talk to their doctor about next steps. This may include more scans, tests, or biopsies. If the scans are abnormal and suspicious, then the patient will most likely have to undergo additional testing, such as a biopsy. And so we've seen that lung cancer screening saves lives, but your question you may be wondering is, can all individuals still get screened for lung cancer during the pandemic, and is it safe to do so? So during the pandemic, unfortunately, cancer screenings have decreased significantly. However, COVID is not going to stop lung cancer. So if a patient is high risk for screening or high risk for lung cancer and requires screening, it's really important that they get their annual screening. And right now, most hospitals have lung cancer screening programs that are COVID safe. You can wear your mask during the entire process and you can take precautions. So that should not be a barrier to you getting your annual screen. And another question we often get is how vaping and e-cigarettes affect lung cancer risk. Vaping and e-cigarettes are relatively new and have become more prevalent in the last decade. And while the long-term effects of vaping and e-cigarettes are still being studied, it's clear that for individuals who have never smoked before, they can increase their risk of lung cancer. E-cigarettes and vaping fluids contain nicotine derivatives and heavy metals along with other chemicals, and they arise both as elements of the e-liquid and a result of organic reactions in the electronic cigarette device. Various studies demonstrate in vitro transforming and cytotoxic activity of these derivatives. Vaping causes fewer health risks than smoking, but it should be noted that it's not a risk-free activity. Vaping can increase heart rate, decrease air volume in the lungs, and increase airway resistance. Furthermore, e-cigarette device use has been significantly increasing, particularly among young adults and non-smokers, making it an area of significant concern for the future. Additionally, while lung cancer screening has the potential to save many lives, it's really important to address smoking cessation in the context of screening. Lung cancer screening is not a substitution for smoking cessation. Likewise, smoking cessation is not a substitute for lung cancer screening. Smoking cessation is one of the best ways to prevent lung cancer, and lung cancer screening is the best way to detect lung cancer early. Using both is the best way to fight the disease. For every year after an individual quits smoking, their risk for lung cancer is reduced by 8 to 17%, depending on the lung cancer they have. Another reason that smoking cessation is important is because it's required by Medicare and Medicaid services for lung cancer screening programs. We do understand, though, that smoking cessation is extremely difficult, but there are a lot of resources that people can use to try to quit smoking. Some of the great programs include wellness and quit smoking programs and the Cancer Coalition's Quit Smoking program. If you have any questions about smoking cessation, feel free to reach out to us. And as this presentation comes to a conclusion, we want to just talk about what the American Lung Cancer Screening Initiative is doing to begin the widespread awareness, education, and advocacy efforts necessary to increase the lung cancer screening rates. Lung cancer is unfortunately the deadliest cancer in the world, and while screening can save so many lives, very few high-risk individuals are currently getting screened. We're working to address all aspects of the issue. We wrote and advocated for House and Senate resolutions expressing support for Lung Cancer Awareness Month and early detection through lung cancer screening. And in December 2 years ago, our Senate resolution was passed by unanimous consent. Additionally, we're working to teach communities across the country about lung cancer and screening. Lung cancer, again, is the deadliest cancer in the world, but by working together, we can overcome it and save millions of lives. It starts by working together to raise awareness and initiate lung cancer screening programs in our communities. These are some old events that we had, and if you're interested in learning about upcoming events, please visit our website. And I'd just like to end by opening it up to any questions you may have. We're so grateful for Needy Meds and to our audience for allowing us to present today and for giving us the space to talk about lung cancer. And I'd love to take any questions.
Raya, thank you so much for that very informative and up-to-date presentation about the focus of the American Lung Cancer Screening Initiative and really how it applies to all of us. The amazing thing about the American Lung Cancer Screening Initiative, I think, is that you take a really complex issue and you make it something that is really easy to understand, and most importantly, make all of us understand why it's so important to everyone. I am always have heard we've, as I said, Needy Meds has been partners with the American Lung Cancer Screening Initiative, so I have heard some of the statistics before, but they're always updated, and I am just blown away by that 6% of the people in the U.S. will actually die of lung cancer this year, and what really drove it home for me as well is, in addition to the statistics, how authorities have really narrowed down very specifically who should be getting screened and how to get screened. Making it something that people can actually put into action is probably the most important thing, at least to me it is. For those of you that are joining us, also, as Raya summed up her presentation, she talked about awareness and how you can ways to share this important initiative. And throughout the presentation, she talked about how awareness is really one of the ways to combat people dying of lung cancer. So one of the things everybody that's listening in can do is, first of all, let your neighbors, your friends, your loved ones, patients, clients know that Needy Meds does invite the American Lung Cancer Screening back for future webinars. So you can check out our upcoming calendar of events, which is on the bottom right hand of our homepage, as well as our webinar page. And you will be able to see other American lung cancer screening initiatives. I will also stress, as I mentioned in the beginning of the presentation, this webinar is being converted into a video and will be posted on the Needy Meds YouTube channel. The reason that's important is because not only can you go and rewatch it to, if you can't remember all of the important information that Raya shared with us, but you can also share the link of this video with those that are important to you. Because as Raya drove home, awareness about how to get screened and how easy it is to do so is super important. And Raya, I do see a lot of questions coming in from our audience. So thank you to everybody. We're going to get to that in just a moment. In the meantime, I will remind everybody that if you are having difficulty affording your healthcare costs, please reach out to Needy Meds. Check out needymeds.org. Reach out to one of our call center counselors at 1 800 503 6897 and join us for upcoming webinars. We do try and pepper our calendar of events with webinars also about Needy Meds and the resources we offer. So check those out. And as we get to those questions, I want to leave up the contact information for the American Lung Cancer Screening Initiative. Raya encouraged everybody to check out their website, which is at ALCSI, American Lung Cancer Screening Initiative, alcsi.org. You can follow them on Instagram. If you have questions, you can drop them an email at info@alcsi.org. So let's get to some of those questions coming in. One of them, Raya, is you talked a lot about guidelines, and you also had an opportunity to talk about some updated ones. One of the questions that came in was, why were changes made to the previous screening guidelines? And I think that's a great question.
Yeah, that's an excellent question. Just a reminder for everyone, the new updated guidelines recommend that anyone between the age of 50 to 80 who has a pack year of 20 pack years and is a current or smoker or has quit within the past 15 years get screened. And these new guidelines are really important because they broaden who is considered high risk to include minorities, underrepresented minorities, and to include more women. So it's really important that people know and are aware of the updated guidelines because they include much more, many more people to be screened.
So important. Another question that came in, is it recommended for non-smokers or never smokers to get screened under the current guidelines?
Another great question. As I mentioned in the presentation, about 10 to 20% of people diagnosed with lung cancer are never smokers. Unfortunately, the guidelines only include people with heavy smoking histories. But again, if you're concerned about your risk of lung cancer, given your family history, given other conditions, definitely talk to your primary care provider. There are a number of ongoing studies, recent studies right now that are looking into lung cancer risk as a never smoker, but right now you need to have a 20 pack year smoking history.
Thank you for that. And another question that came in, and you did have an opportunity, this came in pretty early during the presentation, and it's something that you actually addressed later on during the webinar, but I think it's a great opportunity to readdress it and drive it home. The question is, considering COVID-19, is it recommended to still get screened? And is it safe to do so if you're wearing a mask? Can you talk a little bit about that, Raya?
Yeah, that's a great question. It's definitely recommended that you still get screened, whether it's your first screen or whether it's an annual screen, a repeated screen, because again, lung cancer is not going to stop because of the pandemic or because of COVID-19. You are definitely able to get screened fully masked, and there are definitely precautions in place in the hospital or the screening center to minimize COVID risk. So while COVID is a very serious concern, we still recommend that you get screened, taking all of the necessary precautions.
Such a great question, and thank you for the thorough answer. One of the things that I find super helpful is, Raya, not only do you talk about why it's important for people to get screened, but as I said, the process of what it's like to get screened. You go to your primary care physician. If you go and get screened, what does it look like? I really like to have my expectation managed because it keeps my anxiety lower. So if I go into this knowing I'm going to have to be laying down on my belly for a few minutes, I can wear a mask. If I know what to expect, I just feel a lot calmer. So I think that the fact that that's included in your presentation is very helpful. And I'll encourage our audience to share any feedback you may have as well. And you could do so, of course, by typing any feedback you have into the questions or chat section of your GoToWebinar control panel, and everyone will receive an after the webinar survey. And there is room for some comments there, and we encourage you to really take advantage of that field. As I said in the beginning of the presentation, we do our best to keep the question segment brief. So if you did ask a question and we didn't get the chance to answer, please don't hesitate to reach out to the American Lung Cancer Screening Initiative or Needy Meds directly if you need a response to your question immediately. But we will follow up with you via email as soon as we get the chance. With that, I want to extend a big thank you to Raya for taking time out of her day to share her expertise with the Needy Meds audience, and of course to those that took time out of their day to join us as well. Thank you so much. We do hope you check out our calendar events for other upcoming webinars you're interested in. And as I said, I suggest subscribing to the Needy Meds YouTube channel. That way, you won't miss any webinars, presentations, or videos, and you'll be notified whenever we upload new content, such as today's American Lung Cancer Screening Initiative webinar. Once it's uploaded, you'll be able to not only rewatch it, but very importantly, share the link with your loved ones, neighbors, friends, patients, and clients. Because as Raya had the opportunity to say a number of times throughout her presentation, awareness is really hugely important to helping the American Lung Cancer Screening Initiative save lives. Thanks, everybody, so much. Have a wonderful rest of the day, and we do hope you stay in touch with both Needy Meds and the American Lung Cancer Screening Initiative. Take good care.